Hello friends, I'm back to talk in another very brief video about what it's been like to transition to a cupping practice after mastectomy. I went flat after mastectomy, if you don't know me, and so I only have a little bit of skin here that was made into a Goldilocks mastectomy on this side. And on this side I'm very flat and a little bit concave on my rib cage side. So I have been flat on this side for just over a year and flat on this side for about 4.5 months. And so I've gotten over all of my physical therapy appointments. I'm past that now. But during the last 3 physical therapy appointments, my physical therapist used cupping on me as a therapy to make sure that my skin and my scar tissue were not adhering to one another. And I really enjoyed it. I was a little afraid to start it because I think, well, those of us who are in touch with history and maybe some historical dramas, you kind of think about the glass cups where they kind of light it on fire and singe your skin and leave big welts on your back. And that's not the type of cupping I'm talking about. I'm talking about a much lighter and easier and actually something you can self-perform pretty easily and safely at home form of cupping. So I'm not going to go into all of the technicalities and even the approach. I'm not going to show you how I do the cupping because there is such an excellent video here on YouTube and done by an expert that is actually trained and schooled to do that, who is a lymphedema physical therapist. So I will link you to her video down below for all of the technical approach and details. But I just wanted to tell my story and kind of how I go about this and how I have made it an almost daily practice for myself right now, at least while I'm still feeling tightness in my side. It's mostly on this side that I'm doing it because I still feel a little bit of tightness in my rib cage here where the scar tissue is adhered to, I guess, my ribs. I don't know if it's my ribs or my fascia and my muscles, but there's something down here that does feel like it needs mobilized, and I'm sure that's true of most of us who have had mastectomy. I can't speak for someone that's had implants. Obviously, you're not going to do cupping over your implants. You definitely want to talk to your doctor about that because I have no idea what the implications and health hazards or safety of that is. But I do know as a flat person who I am missing my fascia on my pectoral muscle on this side, but I still have it on this side. So the only thing I'm missing is that fascia on this side, and it's totally fine to do cupping without your fascia on the muscle, especially if you've waited 6 months to do so. You don't want to do this right after surgery, certainly. And again, I'm not the expert, so please do not, please don't look to me for advice about how to do this. I'm just sharing my personal experience and some of the things that I've really liked about this experience. So like I said, I've had 3 sessions of physical therapy wherein my physical therapist did this for me, so I was able to watch her do it, which was really handy. She used a lubricant that I was not a fan of. It was a mineral oil, petroleum-based product, which I never allow practitioners to use on me, but in her case, I wasn't able to stop her soon enough the first time, and then I just let it go the second and third times because she had no other alternative for me, and I had forgotten to bring my own lubricant. You definitely want some sort of lubricant. I recommend body butter. It is less drippy than oil, and yet it provides that kind of slick and smoothness that you need just to give a little bit of moisture to the skin so that you can move the cup around if you would like to. I'll show you my cups first. I got these for $36 at my massage therapist office, and I will link the details of this below. This brand, Lure Essentials, has many different choices, and all of their packages come with multiple cups. This one came with 6, I believe, in a few different sizes. And I like the smallest one the best. This is the one that I use just about every day. It is made of silicone, and you can use it either as a mobile cupping, moving around, or you can use it as a static cupping tool, which would be just leaving it in one place with the suction in place in one spot on your body, just to work on that tight spot and pull the skin away from the tissue, whether it be muscle or fascia underneath or scar tissue. So the body butter that I use that I like is a local brand. You probably won't be able to find it, and you don't need to because you can use any body butter. But what I recommend is doing organic based products. So this has just shea butter, coconut oil, and essential oils, and it's whipped. So this is a nice light whipped body butter that sinks in really quickly. This container is super light because when you whip those oils, the shea butter and the coconut oil, it becomes very lightweight and fluffs up, and is actually mostly air, but it's sustainable. And so this is a little bit drier of a consistency. It's not quite as drippy as like a lotion bar might get, or just plain coconut oil, or even like beeswax might get a little bit drippy. This is more sticky and dry. And so I rub that into my chest here, and I just put a little bit on. You don't need a whole lot. And that allows for you to grab with suction. I've got it suctioned onto my hand right now. And that allows the suction to take better grip. And then you can also move it around and slide it around really easily on your skin if you would like to. And it also allows you not to get a lot of oil or oil stains on your clothing, because I like to do this while I'm watching TV. So I'm in our little TV room with my husband usually, and I keep this next to me. Probably eventually I'll keep this next to me, but the truth is my dog loves this. She really wants to chew it up and use it as her own toy because she loves the noises it makes on my skin. So I have to kind of keep it separated and protected from her right now. But anyway, I grab this out of the package, put a little bit of the body butter on my skin, and then I just reach under my shirt and do some pulling and squeezing, and sometimes it makes a little squeezy suction noise, and my dog really likes that, and she really wants to play with this again. So I do that for like maybe 20 minutes, and it's kind of addictive, the feeling of it. It's never been painful for me. I'm sure it's possible that it could be painful for you. But again, it doesn't involve any heat at all. We're just using lotion, skin, and this guy, and just moving it around a little bit. And what it does is it just makes sure that your scar tissue isn't binding to all the other tissues that are under your skin in your body. And I really like that idea, not because I'm ever going to be putting any substance in there that need to loosen up my skin for, but I just like the idea that it's not binding, that as I age, as I might gain weight or lose weight, my skin isn't going to be pulling against any scar tissue that would be painful in the future. I have no pain at all after mastectomy, and I had very, very simple mastectomies because I did go flat. I didn't have any reconstruction at all, aside from a very brief procedure to save a little skin on this side. But I don't have pain issues, and I really want to make sure that I don't in the future. And this is just insurance against that. It also helps with lymphatic drainage, and you will hear more about that in that technicalities video that I'm linking below from that physical therapist who is an expert. So this definitely helps with binding of scar tissue to skin, and also helps with lymphatic drainage if you do it in a certain way and in a certain motion. I don't always seek to do the lymphatic drainage technique when I'm doing cupping. I'm usually just working on the tough spots that are feeling kind of stuck and a little bit painful when I tug on them. So it's always been this area right here in my ribs on the side that has felt a little bit immobile and a little bit painful when I'm tugging on it. So that's the area I mostly work on. I could work on this side as well, but I don't have any of those stuck areas over here. So periodically I might work over here in my rib area just to make sure it is staying mobilized and not getting bound with more scar tissue. This is definitely a more recent surgery, so I still have a couple months to wait before I go kind of crazy over on this side and get the cupping going as a daily practice. But for now, I'm working on the side that's a year past mastectomy. Again, always follow the orders of your own personal physical therapist or doctor, or oncologist in this case. I am not recommending that you follow the other YouTubers' advice above your own doctor or medical professionals, and certainly not my advice, because I'm only here to share my personal experience and just to kind of make it less of an obstacle. I had no idea that these were only $36 for a set of 6, so $6 each. I'll probably bring this package to my next Flatties gathering locally and give away the other 4 or 5 of them because I know I will never use all of them. But I'll show you kind of what they look like in terms of their size. So there was one really big one that I just don't think I'll ever use. And it is, you know, big enough that I can't capture my palm. It is too big for my palm to suction against. And so I don't think that this would be good for me. Probably someone with a wider body than mine would benefit from one like this. And I have 2 of these large ones. And then I have 2 mediums and then a small one. I guess I could take it out of the packaging and show you what the small one looks. Oh, I have 3 mediums and a small. So I'll probably keep this little tiny guy and maybe 1 or 2 of the medium-sized ones. And yeah, and leave it at that and give away the rest of mine. So pretty affordable investment for all of the benefit that you can get. And if you have a partner that's willing to massage you, these would be really, really amazing on the back and neck as well. For those of us who have a lot of muscle soreness and tension in our back and neck, I'm looking forward to convincing my husband to use these on those parts of my body as well. So just another type of massage that is like super effective and that I'm really enjoying. And I did not realize that it would become kind of an addictive practice. That is really surprising to me. So again, there's been no drawbacks to this. I don't need a professional long-term to keep doing it on me because I can do it on myself really easily just as I'm watching TV and not even engaging. Don't want to get too zoned out because you don't want to do it for too long and keep it in one spot for too long. But really easy to make a part of something else that you're doing in a given day. And the only possible downfall is if my dog were to get a hold of this and chew it up. It would be pretty hard for her to chew it up, but I'll probably keep an extra one hidden away in the bathroom cabinet just in case she does. So to me, it's a no-brainer. I wish that I had discovered it sooner. My physical therapist, I'm surprised she didn't turn me on to it. It probably would have been a liability for her to tell me that I could go and purchase these on my own and show me how to do it on my own. So that's probably why she didn't do it. But I imagine it would be fine to ask your physical therapist to give you lessons if they have been trained in this. And if not, you can go to a massage therapist that has. It's becoming very common and a really common practice in massage therapy, especially these days. You might see, like, especially during the Olympics, if you look at the Winter or the Summer Olympics, you might see like red circles on the backs of athletes where people have been cupped. My impression is that those are not from these silicone cups. Like, I don't think these would leave a long-term bruise on you like those hot glass ones do. So I really don't think that you can expect to see that kind of bruising, and I certainly wouldn't want that for my own body. But again, consult your medical professional or your massage therapist to see what some of the potential outcomes or shocking results on your body might be. I was cupping a lot one day, and I did see that there was a little bit of, not bruising, but a little bit of almost like broken blood vessels in one spot from it. And so that's been the only kind of long-term day or two long injury, I would say, that came from it. And it probably was because I was doing it for too long. So, and I also have very sensitive, very pale skin naturally. So it could be just my skin type as well that's very sensitive. But again, seek advice, please, from your physical therapist or your massage therapist for this. And I will point you to that video that has been my favorite in terms of just learning about how to do it for the different purposes and how to do it safely. And I will see you next week in my next video. See you then.